Hi guys. I just wanted to talk a little bit about emergency procedures. I know you don't necessarily have a chapter in your book on this, but the NSCA does, in fact, have questions on their exam regarding emergency procedures and basic first aid and CPR. So, my suggestion, as far as the basic first aid and CPR, is for you to go back to your textbook, whether you took LWT 165, which was Heart Saver First Aid with CPR and AED, or if you took LWT 170, which is BLS for the healthcare provider, or you might have taken HSC 140, which is a combination of 165 and 170 together. So my suggestion is to go back and grab that textbook. So you should either have the Heart Saver First Aid textbook or the BLS for the healthcare provider textbook. And in those textbooks, you're going to want to review the procedures on how to perform CPR, the step-by-step instructions on how to perform CPR on an adult victim, okay, and some basic first aid recommendations too. You're going to want to review some of that stuff because, like I said, the NSCA does have questions on those particular types of things on the exam. So you want to be reviewing some of that material as well. But as far as the NSCA's stance, as far as professional standards and guidelines, they say that strength and conditioning professionals like us must develop a written venue with specific emergency response plans to deal with injuries and reasonable foreseeable untoward events within each facility. So, if we do have our own facility, we want to make sure that we have an emergency response plan that's written and it's detailed, okay? And we want to have that posted in our facility. So as far as medical emergency goes, we have to have a first aid kit available. So that even includes if you're doing training in your home, and if you're going into other folks' homes, it can't hurt. It can only help to have a first aid kit in the trunk of your car or in your bag that you can take into that home with you. You want to have it marked, first aid kit, right? It's identifiable. People know what it is. It's accessible. So if you have it in your facility, those people who work for you know where that first aid is and it's accessible to them and it's easily transportable. We want to make sure that it's fully stocked. Okay, so if you're not sure of what does a first aid kit look like, what should it be stocked with, go back to your Heart Saver First Aid textbook. And in your textbook, it has a whole list of what should go in a first aid kit. Okay, so that's something, if again, you're going to have your own facility, you're going to be training out of your home, or even if you're going into a client's home, having your own first aid kit is definitely a must. Okay, and then, of course, follow precautions for preventing disease transmission. So wearing what we call personal protective equipment. So those would be gloves. So that's something that needs to be included in a first aid kit. Wear gloves. Brand new gloves should be stocked in that first aid kit. And that's a great way to prevent disease transmission. Using a pocket mask when we do CPR, when we do putting that pocket mask on, will reduce disease transmission. So we want to follow those precautions to, in any way, shape, or form, reduce transmission of diseases. So washing your hands immediately after giving care, that sort of thing. Wearing protective gear, right? Glasses, protective, eye goggles and stuff like that. So definitely responsibilities are things that, we should identify who is going to be doing these particular things. So this again goes back to if you have a facility and you have multiple employees, who is that person that's going to be the go-to person that's going to, attend to that person. If somebody in your facility gets hurt, who is that person who is going to provide care? Now, like I said in my last presentation, that anyone in your staff should be certified. Okay, and if they're certified, they should also be able to maintain their current CPR and first aid, certification card from the American Heart Association. So most everybody that is going to be working for you should have, if not everybody, should have that CPR and first aid certification under their belt. So pretty much anyone on your staff could, provide care if needed. But sometimes in certain places of business, they have that one person who, when I'm at work, my job is to deal with medical related emergencies if something goes wrong. So we're going to recognize, there's a problem, number one. First and foremost, we have to recognize that something is wrong, whether they're, are they unconscious? Are they breathing? Do they have a pulse type of thing? And then knowing, when do I need to call 911? If it's a life-threatening emergency, we know that's the time we need to call 911. And life-threatening emergencies are things like they're unconscious, they're not breathing, they do not have a pulse, right? Those are all considered life-threatening, and that's reasons why we should call 911. We want to make sure that, who's going to get the first aid equipment. So maybe if I'm that person that's, in charge of taking care of the individual that's hurt or injured, while I'm caring for that, I might direct and say, hey, go get the first aid kit, get the AED while I'm caring for this individual. Okay, so who's going to assist that principal caregiver? So responsibilities. And so having a plan of action in place, knowing who is in charge of this, who's in charge of that if a medical related emergency occurs. As far as emergency procedures go, we also need to verify that the responders are en route. When we call 911, a lot of times we have to stay on the phone with them. So we'll know, the responders they're on their way. They'll tell us they should be there. They're only a few blocks away, that sort of thing. Also, we want to make sure that we take care of the crowd. If it's in a facility and there's many members around and we have an injured person, we want to control the crowd, make sure everybody stands back, they stand clear to give room for the paramedics or whoever it is that's coming to care for that individual has room to do so. We want to show the paramedics where to go, so we want to make sure somebody's at the front door so they can, walk them in and show them where to go, and then take responsibility for the coordination of the overall effort. So again, who is that person that's in charge of these, emergency type procedures? It might be you, the boss, whoever's in charge of the facility. So some medical related emergencies, the most common ones we might see would be things like cardiac events, people suffering heart attacks or sudden cardiac arrest. A lot of times people get these two mixed up, and the care for each one is a little bit different. If somebody's suffering an MI, myocardial infarction, a lot of times they're conscious. So the best thing we can do for an individual who is suffering a heart attack is having them sit, rest comfortably, stop doing what they're doing, and call 911, right? Because if we can recognize the signs and symptoms of a heart attack, we want to know that that's pretty serious and we want to call 911. So somebody having chest pains for, more than 3 to 4 minutes in length, they might feel like they have a weight laying on their chest. They might feel like indigestion, and a lot of people tend to pass it off and think it's indigestion and pop Tums. But if we know, what those signs and symptoms of a heart attack are, that can increase their chances of survival. Excuse me, sudden cardiac arrest. Cardiac arrest, normally what's happening is that person is unconscious, they're not breathing, and they do not have a pulse. So we need to be able to monitor that situation. If we come in and we witness a person laying on the ground, first of all, we want to determine if they're conscious. So we're going to check for consciousness. If they don't respond, we're going to check breathing and we're going to check pulse kind of simultaneously at the same time for 5 to 10 seconds. If we don't determine either, we're going to send somebody to go get the AED, automated external defibrillator, and call 911. And then we can begin CPR. And CPR for a person who has sudden cardiac arrest is generally going to be 30 compressions on the center of the breastbone, followed by 2 rescue breaths. Okay, and when we do those 2 rescue breaths, you're going to want to do a head tilt, chin lift. So you're going to open up that airway, give those 2 breaths, which are about 1 minute in length. Okay, and then you're going to get your hands back on their chest and do your 30 compressions. And you would keep doing that until somebody else that's trained can take over for you, or maybe they all of a sudden develop a pulse or they're all of a sudden breathing, then you could quit doing that, those compressions and breaths. But knowing that basic care, knowing how to perform CPR is a must in a facility of that nature. So definitely want to have certified staff, all right? They need to have maybe that Heart Saver first aid certification, and the CPR and the AED component is also very important. So all of our facilities need to have an automatic external defibrillator, okay, an AED. And what that's going to do is it's going to shock the heart and basically allow it to set itself back into a normal sinus rhythm. And research is showing that the quicker an AED becomes available and the sooner we get the pads on the chest for that victim, their chances of survival will go up. So having an AED placed again in an accessible point in our facility is very, very important because it does increase the victim's chances of survival. So basic first aid, basic CPR. Again, I encourage you to go back to that BLS textbook or the Heart Saver First Aid with CPR textbook. And that's going to go over, some of the information, like I said, because you're going to probably have quizzes on the NSCA exam or questions on the NSCA exam that cover, those types of things. So we definitely need to also have an emergency response plan for, acts of God. If there's, a flood or a tornado or an earthquake, where's the safe place, in our facility that these folks need to go to. We need to practice and rehearse those emergency response plans with our staff on a regular basis so they know how to proceed if any of these, tornadoes or, earthquakes or things of that nature do occur, terrorist attacks. And it should be evaluated by the risk managers. So we want to make sure that it's evaluated on a regular basis and changed as needed. So again, just some basic emergency related issues that I wanted you to be aware of, even though, like I said, your textbook doesn't cover a lot of that material. But I know on the NSCA exam you will have some questions in regards to that material, and not a lot, but there will be a few.